Namaste, I am Dr. Chaitra Gowda, Consultant Obstetrician Gynecologist at Cloudnine Hospital, Bellandur. We see PCOS in around 27% of the women. What is the cause for these increasing incidence in the PCOS? It is mainly because of the lifestyle, that is stress levels. See, the ovary and our brain, the pituitary and hypothalamus, are very much complexly interrelated. Any changes in the stress levels will change our pituitary and hypothalamus hormones, which in turn stimulates the ovaries, and it creates an hormonal imbalance there. And also stress increases the cortisol levels, which comes from the adrenal glands, which is situated above our kidneys. And these cortisol levels, when it gets increased, there will be decrease in the progesterone level. So if there is imbalance between the estrogen and progesterone, decreased progesterone and increased estrogens, again the manifestation of polycystic ovaries will increase. And also because of the increasing rates of sedentary lifestyle and obesity, there is more of glucose intolerance. That is, glucose is not metabolized in the body properly. So what happens is the insulin level raises. The pancreas will secrete more amount of insulin to metabolize the glucose. This excessive insulin goes and stimulates the ovaries to produce androgens, and this androgens in turn increases PCOS, and this becomes a vicious cycle. The stress, obesity, sedentary lifestyle, increase in the insulin, cortisol levels, and it stimulates the ovaries to produce androgen, and again it becomes a vicious cycle. So where do we break it? It is from our lifestyle. How do we do? First thing is food intake. Make sure our food contain as much as less glucose as possible. It should be a complex form of carbohydrate. Simple sugar should be avoided, and food should be like more of proteinaceous, and raw vegetables should be more. Avoid all junk foods, high fatty, refined foods, maida, all those you should avoid completely. And each meal should contain more amount of protein and less amount of carbohydrates in that. And women who have this PCOS should have a proper gap between two meals. That acts a kind of intermittent fasting and helps in controlling the insulin levels. So if these food habit changes, if you are maintaining at least for 6 months to 1 year, definitely there is a change in the PCOS morphology. So when you make sure it is like 2 major meals and 2 snacks in between, especially for PCOS. And coming to exercises, daily at least 45 minutes to 60 minutes of exercise with some amount of muscle workout helps in increasing the muscle sensitivity and also the cell sensitivity to utilize glucose well, so that the insulin level decreases, and over a long period of time the PCOS changes in the ovary will decrease. And also you should start practicing pranayama and yoga, because good amount of oxygenation in the tissue and cells will decrease the inflammation over long term, which actually decreases the PCOS. So mainly concentrate on food intake, regular exercises and workout, and good amount of quality sleep without any disturbance, and yoga and meditation. These 4 things, if you are doing persistently, definitely PCOS will come under control. For short term manifestations of PCOS like infertility, menstrual irregularities and other things, we treat it with medications. But over a long term, we cannot treat PCOS throughout life. Only for short term like 6 months we can give medications, but over a long term, lifestyle modification definitely helps PCOS patients.